Welcome future registered nurses in the United States. In this video, we're practicing NCLEX-style questions for 2026, with clear, exam-focused rationales to help you think like an NCLEX test taker. A client with hypocalcemia is most likely to exhibit which sign? Correct answer is B, Schwastek's sign. Rationale: hypocalcemia increases neuromuscular excitability, causing facial twitching when tapped. A nurse is teaching about insulin administration. Which site provides the most consistent absorption? Correct answer is C, abdomen. Rationale: the abdomen provides the most predictable and rapid insulin absorption. A client with metabolic acidosis will most likely exhibit which breathing pattern? Correct answer is C, Kussmaul respirations. Rationale: deep, rapid breathing helps eliminate excess CO2 to compensate for acidosis. A client with Addison's disease is at risk for which electrolyte imbalance? Correct answer is C, hyponatremia. Rationale: Addison's disease causes decreased aldosterone, leading to sodium loss and potassium retention. A nurse is caring for a client with hypoglycemia. Which symptom is expected? Correct answer is C, tremors and diaphoresis. Rationale: hypoglycemia activates the sympathetic nervous system, causing shakiness and sweating. A client with myasthenia gravis develops sudden muscle weakness and difficulty breathing. Which medication should the nurse anticipate? Correct answer is C, pyridostigmine. Rationale: this client is likely experiencing a myasthenic crisis, requiring increased acetylcholine availability. A client with type 1 diabetes is NPO for surgery. Which order should the nurse question? Correct answer is D, discontinue all insulin. Rationale: type 1 diabetics must receive basal insulin to prevent DKA. A nurse is caring for a client with a spinal cord injury at T6. Which finding suggests autonomic dysreflexia? Correct answer is C, severe headache and hypertension. Rationale: autonomic dysreflexia causes sudden, dangerous hypertension. A client with septic shock is receiving norepinephrine. Which assessment finding best indicates the medication is effective? Correct answer is B, mean arterial pressure, MAP, greater than or equal to 65 mm of mercury. Rationale: vasopressors are titrated to maintain adequate organ perfusion, reflected by MAP greater than or equal to 65 mm of mercury. A client with chronic alcohol use is admitted confused and malnourished. Which medication should the nurse anticipate first? Correct answer is B, thiamine. Rationale: thiamine must be given before glucose to prevent Wernicke's encephalopathy. A client with atrial fibrillation suddenly becomes hypotensive and dizzy. What is the nurse's priority action? Correct answer is B, prepare for synchronized cardioversion. Rationale: unstable dysrhythmias require immediate cardioversion. A nurse is teaching a client about nitroglycerin. Which statement indicates a need for further teaching? Correct answer is D. I will take it daily to prevent chest pain. Rationale: sublingual nitroglycerin is used as needed, not on a scheduled daily basis. A client with chronic kidney disease is prescribed spironolactone. Which laboratory value is most important for the nurse to monitor? Correct answer is C. Potassium. Rationale: spironolactone is a potassium-sparing diuretic. Clients with kidney disease are at high risk for hyperkalemia, which can cause life-threatening dysrhythmias. A nurse is caring for a client with increased intracranial pressure, ICP. Which finding requires immediate intervention? Correct answer is C. Bradycardia and widening pulse pressure. Rationale: these are classic signs of Cushing's triad, indicating dangerously increased ICP and possible brain herniation. A client receiving magnesium sulfate for preeclampsia shows decreased reflexes. What should the nurse do first? Correct answer is C. Check respiratory rate. Rationale: respiratory depression is the most dangerous effect of magnesium toxicity. A client receiving IV morphine develops shallow respirations of 8 per minute. What is the nurse's priority action? Correct answer is C. Administer naloxone. Rationale: naloxone is the antidote for opioid-induced respiratory depression and must be given immediately. A client with hyperthyroidism is most likely to experience which symptom? Correct answer is D. Heat intolerance. Rationale: increased metabolism causes excessive heat production. A client with diabetic ketoacidosis, DKA, is being treated with insulin. Which finding indicates therapy is effective? Correct answer is C. pH returning to normal range. Rationale: correction of metabolic acidosis is the key indicator of DKA resolution, not just blood glucose control. A nurse is teaching a client about warfarin therapy. Which statement by the client indicates understanding? Correct answer is C. I will have my INR checked regularly. Rationale: warfarin requires close INR monitoring to prevent bleeding or clotting complications. A nurse is caring for a client after a lumbar puncture. Which position is recommended? Correct answer is C. Supine. Rationale: lying flat helps prevent post-lumbar puncture headache. Which finding suggests hypovolemic shock? Correct answer is C. Tachycardia and hypotension. Rationale: loss of circulating volume leads to compensatory tachycardia and low blood pressure. A client with sepsis has a blood pressure of 84/50 mmHg, heart rate 128 per minute, and urine output 15 milliliters per hour. Which provider order should the nurse implement first? Correct answer is C. Administer 4 normal saline bolus. Rationale: in septic shock, fluid resuscitation is the priority to restore perfusion before vasopressors or antibiotics. A client with COPD is receiving oxygen at 6 liters per minute via nasal cannula. Which assessment finding is most concerning? Correct answer is C. Drowsiness and decreased respirations. Rationale: high oxygen levels can suppress the hypoxic drive in COPD clients, leading to respiratory depression. A postoperative client suddenly reports chest pain and shortness of breath. What is the nurse's first action? Correct answer is B. Place the client in high Fowler's position. Rationale: positioning improves ventilation immediately while further interventions are initiated. A client with hypovolemic shock is receiving 4 fluids. Which finding best indicates improvement? Correct answer is B. Urine output 40 milliliters per hour. Rationale: adequate urine output reflects improved renal perfusion. A client with heart failure gains 2 kilograms in 24 hours. What is the nurse's priority interpretation? Correct answer is B. Fluid retention. Rationale: rapid weight gain indicates acute fluid overload, worsening heart failure. A client is diagnosed with SIADH. Which laboratory finding is expected? Correct answer is C. Decreased serum osmolality. Rationale: SIAD causes water retention, leading to dilutional hyponatremia and low serum osmolality. A nurse is caring for a client with neutropenia. Which intervention is most appropriate? Correct answer is B. Private room and strict hand hygiene. Rationale: neutropenic clients are highly susceptible to infection. Protective isolation is essential. A client with pancreatitis reports severe abdominal pain. Which position provides the most relief? Correct answer is C. Side lying with knees flexed. Rationale: this position decreases abdominal tension and pain. A nurse is caring for a client with metabolic alkalosis. Which assessment finding is expected? Correct answer is B. Confusion and tetany. Rationale: alkalosis increases neuromuscular excitability, causing tetany and confusion. A client on heparin therapy develops a platelet count of 80,000/mm superscript 3. What should the nurse do first? Correct answer is C. Stop heparin. Rationale: this may indicate heparin-induced thrombocytopenia, HIT, a medical emergency. A client receiving total parenteral nutrition, TPN, suddenly becomes dyspneic. What complication does the nurse suspect? Correct answer is C. Air embolism. Rationale: sudden respiratory distress during central line therapy suggests air embolism. Which assessment finding indicates digoxin toxicity? Correct answer is B. Yellow-green vision. Rationale: visual disturbances are classic early signs of digoxin toxicity. A nurse is caring for a client with a chest tube. Which finding indicates the system is functioning properly? Correct answer is B. Intermittent bubbling with coughing. Rationale: intermittent bubbling is expected as air exits the pleural space. Continuous bubbling indicates an air leak. Which medication should the nurse question for a client with asthma? Correct answer is C. Propranolol. Rationale: non-selective beta blockers can cause bronchoconstriction, worsening asthma. A nurse is assessing a client with hypokalemia. Which ECG change is expected? Correct answer is C. Flattened T waves. Rationale: low potassium alters cardiac repolarization, causing flattened T waves. A client with pneumonia is prescribed incentive spirometry. What is the primary purpose? Correct answer is B. Prevent atelectasis. Rationale: incentive spirometry promotes lung expansion and prevents alveolar collapse. A nurse is caring for a client with acute renal failure. Which finding is most concerning? Correct answer is C. Potassium 6.2 milliequivalent/L. Rationale: hyperkalemia is life-threatening and can cause fatal dysrhythmias. A client with anemia is most likely to experience which symptom? Correct answer is B. Fatigue. Rationale: reduced oxygen carrying capacity leads to tiredness and weakness. A client with increased intracranial pressure suddenly has a fixed and dilated pupil. What is the nurse's priority action? Correct answer is C. Notify the provider immediately. Rationale: a fixed, dilated pupil indicates brain herniation, a neurological emergency. A client receiving total parenteral nutrition, TPN, suddenly becomes confused and diaphoretic. What is the nurse's first action? Correct answer is B. Check blood glucose. Rationale: TPN can cause hyper or hypoglycemia. Assessment comes before intervention. A client on mechanical ventilation suddenly has high peak airway pressures. What is the nurse's priority assessment? Correct answer is A. Breath sounds. Rationale: high pressures suggest airway obstruction or pneumothorax. A nurse is caring for a client with hypocalcemia. Which finding is most concerning? Correct answer is C. Laryngospasm. Rationale: laryngospasm can cause airway obstruction and is life-threatening. A nurse is caring for a client with suspected tension pneumothorax. Which assessment finding is most concerning? Correct answer is B. Tracheal deviation. Rationale: tracheal deviation signals life-threatening pressure buildup. A client with acute respiratory distress syndrome, ARDS, is on mechanical ventilation. Which strategy improves oxygenation? Correct answer is C. Prone positioning. Rationale: proning improves ventilation perfusion matching. A nurse is caring for a client after carotid endarterectomy. Which finding requires immediate action? Correct answer is B. Neck swelling. Rationale: indicates possible hematoma and airway obstruction. A client receiving oxytocin develops uterine tachysystole. What is the nurse's first action? Correct answer is B. Stop oxytocin infusion. Rationale: excessive contractions reduce fetal oxygenation. A nurse is caring for a client with lithium toxicity. Which finding is most concerning? Correct answer is C. Seizures. Rationale: seizures indicate severe, life-threatening toxicity. A client with acute adrenal crisis is hypotensive and confused. Which medication should be administered first? Correct answer is C. Hydrocortisone. Rationale: adrenal crisis requires immediate corticosteroid replacement. A client has been taking laxatives daily for several months. Which electrolyte imbalance is the nurse most concerned about? Correct answer is C. Hypokalemia. Rationale: chronic laxative use causes excessive potassium loss through the stool. Low potassium levels increase the risk of serious cardiac dysrhythmias and muscle weakness.